Hello everyone, my name is Hannah Messenger and my topic is syphilis. Syphilis is a systematic bacterial infection caused by Spirochete treponema pallidum. Family classification is Spirochaetaceae. This is a gram-negative spiral-shaped anaerobic bacterium. Syphilis can be transmitted during oral, anal, or vaginal sex through contact with infectious lesions. This can also be spread during pregnancy through the placenta. Syphilis may also be transmitted through blood transfusion. There are 4 stages of syphilis: primary, secondary, latent, and tertiary. The incubation period for primary syphilis is 14 to 21 days. Symptoms of primary syphilis include a small painless open sore called a chancre. This may appear where the bacteria infected the body. You may also develop enlarged lymph nodes in the region of the sore. Chancres typically last 3 to 6 weeks, eventually healing themselves. Common symptoms of secondary syphilis include a non-itchy red or reddish-brown skin rash appearing on the trunk of the body, chest, stomach, pelvis, back, and the limbs of the body, arms, legs, palms of the hands, and soles of the feet. At this stage, other signs and symptoms may occur, such as hair loss, muscle aches, fever, sore throat, tiredness or fatigue, weight loss, and swollen lymph nodes. Symptoms may resolve themselves, but if not treated, they may come and go for months to years. The third stage, the latent stage, is considered to be the hidden stage because symptoms no longer occur. During this phase, the syphilis bacteria are still alive in the body, but you are no longer contagious to others. This stage can last for several years. Continuing without treatment may lead to late syphilis, which can be extremely dangerous. The fourth and final stage of syphilis is the tertiary stage. Syphilis isn't contagious at this point, but the infection has started to affect the organs in the body. This can lead to death. Symptoms include brain damage, dementia, and cognitive health problems, heart disease, problems controlling muscle movement, nerve damage, seizures, and vision problems, including blindness. If a pregnant woman is infected, her fetus can be infected before birth if the bacteria that causes syphilis crosses the placenta. When a baby is born with syphilis, the infection is called congenital syphilis. Congenital syphilis can cause miscarriage, premature birth, low birth weight, stillborn, and even the death of the unborn fetus. Additionally, a baby born with congenital syphilis may become blind or deaf, have developmental delays, or suffer health problems such as bone deformities, meningitis, and severe anemia. Like syphilis, congenital syphilis can be treated with antibiotics. The key is to start treatment as soon as possible after birth to prevent the baby from further complications down the line. Congenital syphilis has become much more common in the United States in recent years. Cases have increased by over 500% since 2010. The reason for these alarmingly high statistics is unknown, but researchers suspect the involvement of low-quality healthcare in general and a decrease in public health activities for sexual health, including a decreased number of public health nurses and field staff following up on infected patients. Syphilis is most often transmitted through sexual contact, although it can be transmitted in other ways. Syphilis occurs worldwide, most commonly in urban areas. The number of cases is increasingly high in men who have sexual intercourse with other men. Young adults ages 20 to 35 are the highest risk population. In 2020, the Centers for Disease Control and Prevention, CDC, reported that men who have sex with only men represented 42% of cases, approximately 16,000 individuals, and that men who have sex with women only represented 19% of cases, approximately 7,000. Pregnant women in low and middle income countries represent an overwhelming number of infected individuals due to lack of antenatal care during their first visits. Additionally, sex workers are disproportionately burdened with syphilis in all regions. Those groups may suffer from poor access to healthcare due to stigma and discrimination. Taking a deeper dive into fatality rates specifically in the United States before penicillin was invented was 10%. Between 1968 and 2015, we saw a significant decrease in syphilis cases. Cardiovascular syphilis deaths went from 338 a year to 3. Neurosyphilis deaths went from 191 a year to 33. And congenital syphilis deaths went from 28 a year to 2. But since 2018, an increase has been observed. As you can see in the graph, the lowest recorded number of syphilis was in 2000. The rates remain relatively low until 2014. Your healthcare provider can diagnose syphilis by testing samples of blood, fluid from a sore, or fluid that surrounds the brain and spinal cord. Blood tests can confirm the presence of proteins called antibodies. The immune system makes antibodies to fight off infections. The antibodies to the bacteria that cause syphilis stay in the body for years, which means your provider will be able to detect current or past infections. A laboratory can study fluid from a sore under a microscope to confirm that syphilis caused the sore. Cerebrospinal fluid is the fluid surrounding the brain and spinal cord. If your healthcare team thinks you are suffering from nervous system problems due to syphilis, they may recommend testing this fluid. Syphilis is simple to cure when it's found and treated in its early stages. The preferred treatment at all stages is penicillin. This antibiotic medication can kill the bacteria that causes syphilis. At this time, no vaccines are offered, but prevention methods are highly encouraged, such as practicing safe sex, avoiding street drugs, and screening often if your partner is infected. And most importantly, speak to your healthcare provider if infected while pregnant. With that, breastfeed with caution if infected. As mentioned earlier, new statistics from the last several years show a dramatic increase of 80% from 2018 to 2022. Experts point to various reasons for the increase, including greater usage of substance abuse tied to risky sexual behavior, decrease in condom use, ongoing social and economic conditions, and reduction in sexually transmitted infection services at both state and local levels. As you can see in the graph, in 2014, 1.9 million people were infected with syphilis. In 2019, approximately 2.6 million people were infected with syphilis. Over the span of 5 years, that is an increase of 700,000 cases. And here are my references in case anyone wants to take a deeper dive into what I've discussed today. Thank you so much for watching. I hope you enjoyed.